My name is Pavanraj Chana and I'm a medical student at Mo University. Having the opportunity for this presentation with no particular domination in oral skills or rhetoric, I would first like to thank the administrators for BSI for setting up this conference and for the generosity of everyone out there tuned in from one place or another for being my audience. Thank you. With that to say, let's get into it. The title of the presentation is Assessing Community Health in Sugoi, Kenya, a community-based education and services descriptive study. This presentation will briefly explain what community-based education and services is, abbreviated as COBS, and with particular inference to one example, and basically show how a multidisciplinary team of students collected and analyzed data to develop a plan addressing the health of a community. Introduction. There is growing concern about providing health to communities in the rural areas, especially in Kenya, where a large number of the population is. Moi University's College of Health Sciences has responded to this challenge by developing an innovative program called COBS. COBS is a program where a group of multidisciplinary students from the School of Medicine, Dentistry, Nursing, and Public Health strive to evaluate the health needs of a community, identify their health-seeking behavior, learn appropriate disease prevention and control measures, and provide pertinent health services and education. This is all achieved by using a surrounding health center as an entry point. There are 20 of these allocated health centers all over Western Kenya that students are allocated to, and this study is based solely on one. COBS has given hand to collaborate with local primary health care programs, PHC programs, by engaging 4 parties. Institution, which is responsible for establishing objectives and sites for learning and participation. Health facilities, which liaise students with the community and provide resources for aid and learning. Students, who relate with program staff, participate in health centers, organize outreach services to serve the community, and write reports which are shared with local administration. And finally, the community, who provide the environment, plans, and participate in health program implementation. There are many papers and articles out there that highlight the program, noting its various advantages and disadvantages, but I would like to pragmatically describe it with an example. Objectives: to identify the administrative structure and socio-demographic status of a community, to assess the general housing and sanitary conditions of members of a community, to identify environmental and health practices in a community and their use of health care services, to determine the burden, epidemiology, and factors contributing to disease in the community, to assess the nutritional status of adults and children in the community. Lastly, an objective students are personally supposed to achieve is to study primary health care and administrative structures of health centers before embarking to county and national hospitals. Methodology: the study area is Sugoi location, which was one of the 7 locations in Turbo sub-county in Uasin Gishu County in Kenya. The location covers a rough area of 59 square kilometers. Study site: the research was particularly carried out in 3 villages in Kapkong sub-location in Sugoi. These were Sajangwang, Tekletich, and Koshin. The study population: so it included all members of Sugoi location. The location has a population of approximately 15,225 people. Study design: a descriptive cross-sectional design was used, and the study was carried out in 2 sections: community entry and community diagnosis. Sample size, sampling technique, and methods of data collection. Community entry involved conducting interviews with chiefs and elders of these villages, and focused group discussions using quota sampling of 6 men, 6 women, and 3 youth members. which were consisting of 2 males and 1 female. Youth in accordance to the UN is 15 to 24 years. Using probabilistic stratified sampling, community diagnosis employed interviewer-based questionnaires with parameters of primary healthcare elements to be filled by household heads so that quantitative data would also be obtained to supplement qualitative data obtained in community entry. In case you're wondering what elements of primary healthcare are, here is what you would call a mnemonic of what elements means. E for education concerning health programs, L for local endemic disease prevention and control, E for expanded prevention program of immunization against infectious diseases, M for maternal and child healthcare, including family planning, E for essential drug, N for nutrition, T for treatment, S for safe water, and 2 which were recently added, which is dental health and HIV/AIDS, because Kenya has already developed policies and a comprehensive service for these 2. The results were collected from a total of 120 out of 170 households in the 3 villages. Data analysis, a univariate analysis approach was used, and this afterwards we used the multivariate to link up the different variables collected. WHO Anthro software was used to assess anthropometric data for under 5 children. Results. Under demography, most respondents were aged between 31 to 40 years. Females were the most, and we were fortunate that they were most because they could answer questions on maternal health care and for their children. Most respondents were married. 49% of respondents reached primary school level, 33% secondary, 7% tertiary, and 11 had no formal education. Most households consisted of 5 to 9 members. Housing. Most of the people in Kapkong area lived in semi-permanent houses. This is due to the their economic status, and because the material used to make these houses is easily available. 45% of respondents actually shared their house with domestic animals, which range from cats to chicken. This sort of means that there was more chances of contracting animal-related diseases. Water supply. Most respondents source their water from dug-up wells in their households. Protection of these wells and other water sources was generally poor. Several methods were used to ensure that the water collected was safe for drinking, and boiling was the most popular method for doing so. A shocking 26% actually claimed not to use any method to ensure their water was safe for drinking and drank it straight from the source after transporting it to their household. Human waste. Most households had dug pit latrines, but most of them were at the same level or uphill to the source of water used. This could predispose them to waterborne diseases from washed away contaminated feces and underground seepage. Pest and vector control. Presence of mosquitoes was reported to being the highest pest in the household, followed by houseflies, weevils, tsetse flies, jiggers, bedbugs, and fleas. The swampy region surrounding the community and stagnant water within the compound was suggested to be the reason for the high number of mosquitoes. Touching on prevention and control for mosquitoes, the majority were lucky to have their house sprayed by outreach activities or did it themselves. They were given mosquito nets and they got rid of stagnant water. However, it was seen that across the community, some people wrongly used the mosquito nets given. Here is an example of mosquito nets wrongly being used to safeguard crops. Now, this was not only seen in one household but several. Some nets were actually being used to also barricade animal pens. Cultural practices. Most cultural practices were, and to some extent, are still being practiced traditionally. These practices include birth, naming, initiation, marriage, death, and burial. Those that were practiced traditionally have more negative health implications as compared to those that are more modern. Currently, most people go to the health center to give birth because of the improved awareness, but some actually do deliver at home traditionally with traditional birth attendants, abbreviated as TBAs. Now, they still practice these customs because they believe they are more conservative to the culture, and they still use some knowledge of proper health or medical related methods to deliver the children. In traditional in traditionally practiced initiation, male initiates share the cutting knife, posing them to a risk of contracting HIV and other urinary tract infections, as the knives were not sterilized and were shared across every male there. They still practice the customs of the initiation, but now they are being overlooked with supervision of a medical officer. Fortunately, no female circumcision or female genital mutilation was being practiced. Common health problems. Here you can see that malaria, waterborne diseases, upper respiratory diseases, and pneumonia were prevalent diseases reported by the community. Diarrheal diseases among the children are a major challenge. A majority of the households reporting such mentioned frequent use of unprotected water sources and not using any safety method to ensure water was safe for drinking, which could explain the high number of cases. HIV awareness was favorable. Most respondents knew their status. Awareness could be credited to regular outreach, testing, and counseling activities availed. Awareness on non-communicable diseases such as mental health and cancer were, however, sorely poor. There was one referred case of mental health and very few for cancer. For cancer, breast, cervical, esophageal, stomach, and intestinal were mentioned, but it's very difficult to obtain an approximate number of how many people were affected since names are not being mentioned. Dental health. Most respondents brush their teeth once a day, and most of them reported dental illness within the last 6 months. This could be attributed to the poor habits of cleaning, lack of dental education among the community, inadequate dental facility at the Terrible Health Center, and high cost of dental services elsewhere. Under health services, most people actually use self-medication as the first step in illness. However, some resorted to seek medical attention from the surrounding health center. Majority said they rarely got prescribed drugs at the health center. This is due to the inadequate supply of drugs to the facilities by government officials. A high percentage of those people using self-medication did so because it was seen that the benefits of the health center and their perils was not really clear to them to do so first. Under maternal child health, majority of female respondents had their first pregnancy between the age of 16 to 20 years. Family planning. The results show that 71% of those interviewed were aware of family planning methods. Depo-Provera, which is a methodoxyprogesterone acetate derivative, was the most commonly used method. Tubal ligation, condoms, and abstinence were least used. Immunization. Most children in the study were completely immunized, with a good number still ongoing, and there was no child who was not immunized at all. This suggests that more families are taking their children to the health center to be vaccinated and believe in the importance of immunization. The few cases of children missing out on immunization could be blamed on maybe parents forgetting to take their children on appropriate or being aware that different vaccines are to be administered at different times. Nutrition. Most of the respondents got food mainly from farming stocks while a few bought food. The community had a good supply of carbohydrates, minerals, and vitamins, supporting the observation that no malnutrition was reported in the common illness section. Anthropometry: weight for height, mid-upper arm circumference for age, and height for age indices collided. However, the tiebreaker weight for age index, which is used to monitor growth and assess malnutrition for both past, chronic, and/or acute present, showed that the under 5s were normal and generally not malnourished. Conclusions: disease phase could be linked to poverty, poor water protection, vector prevention, and health-seeking behavior evidence discovered. Results and suggestions were discussed with the community heads, elders, and health center staff, and this can hopefully improve the high disease burden. Lastly, I would just like to say the implication of the study. COPS program managed to incorporate theoretical, clinical, and field activities. It actually helped train students to become competent professionals in implementing PHC policies in the nation and enable them to assess factors that impact the health of the community that they will encounter also in the hospital. These are my references, and I would like to say that the point of this presentation was to briefly describe a different approach in health education, and I hope I've achieved that. Thank you.